Continuing on with our clinical case series, this has been a fun one to also kind of flesh out. Had someone come in, had some neck issues, had some back issues, having some shoulder issues, was having some nummy tingly stuff kind of down through a forearm, if I remember correctly. And this now the most recent thing is a lot of stuff was moving better, a lot of stuff was feeling better. Just had a lot of still some fairly sharp pain in the elbow itself. So definitely checked. Make sure that if you've seen our videos before, you also realize a lot of times we're checking the spine. We're making sure that some movements or lack of movement there isn't what's causing the effect downstream. So we checked this person's neck mobility. It was definitely could have used some work. So we got that moving a little bit more, a little bit better. Had them doing some exercises for that. Neck mobility improved. No change in elbow symptoms. Okay, may or may not be the elbow. Rechecked all of the neck movements. There was another one, that wasn't quite so commonly locked or blocked up. So had them work with that for a little bit and then retested the elbow again. Still no change. Great. In this case, we are pretty sure that in that case, we can go down and look at the elbow joint itself. So tested the elbow joint out. There was nothing wrong with the elbow. Orthopedically, everything was good. Just very, very sore over some of the attachment parts of what they call the extensor tendons, or the muscles that bring our fingers and our wrist up like that or up like that. Started moving the elbow around and figured out there was a certain position and a certain movement that we could do kind of repeatedly to load that elbow joint to get it moving and mobile again. Retest the elbow. Pain was gone. Function was back. Strength was back. So it's always fun to see where these go. It's not always the spine. It's not always the joint above. Sometimes it's the joint itself. So in this case, we definitely got the person the correct, hopefully, movements for the elbow itself. Looking forward to checking back with them soon. That was somebody that came in actually this week. So we're checking back soon. Hopefully we're on the right track and on the better and better path. But the thing with the rehab that we do here is it's why we check back with you. We need to make sure it's getting better. If it's regressing, we change it up. If it's getting better, we keep treating. If it's not changing, we throw a little bit more at it. So that's kind of the process, not to oversimplify it, but that's really, it's what we do. It's what a lot of healthcare fields do. And we have a good time seeing all these different things that come in. So we did kind of cherry pick this. This isn't always true for all elbow pain. This isn't always true for all elbow issues. Sometimes it's not always quite so clear cut. But in this case, this is how it worked out.